Hey everyone, welcome back for another deep dive.
It's good to be back.
Today we're going deep on, a hot topic in diabetes management,
Yeah.
insulin icodec.
Big one.
As endocrinologists,
Huh.
you know how much buzz a once-weekly basal insulin is generating?
Definitely.
And we're going to unpack why it's getting so much attention.
Absolutely.
We'll be looking at a commentary article called Counseling for Insulin Icodec, a proposed practitioner's guide
Okay.
from the Diabetes Therapy Journal
Great journal.
to guide our conversation.
Fantastic.
Yeah.
Yeah, this is a really practical guide.
Yeah.
And what stands out to me is how it tackles the patient's perspective on insulin therapy.
Right.
They introduce this 3T model: temperament, troublesomeness, and technicality as key factors that can influence a patient's experience with insulin.
Okay, so let's break down these 3 Ts.
Sure.
Can you give us an example of how each one might play out in a real patient scenario?
Yeah, let's say you have a patient who's generally anxious about needles and hesitant to start insulin.
Right.
That's their temperament coming into play.
Okay.
Then consider the troublesomeness, the daily burden of injections, monitoring adjustments.
Yeah.
That might make them even more resistant.
Makes sense.
And finally, there's the technicality.
Okay.
Maybe they're overwhelmed by the different insulin types, dosing calculations, and injection techniques.
Right.
All of these T's add up.
Yeah.
And if they're not addressed, they can really impact adherence and outcomes.
That's a really helpful way to frame it.
Yeah,
It reminds us to go beyond just the clinical aspects of insulin
absolutely.
and really consider the patient's individual experience.
For sure.
And this is where icodec comes in, right?
Yeah,
The article suggests it could be a way to address some of these challenges.
exactly. Think about the troublesomeness factor.
Yeah.
Having to inject only once a week could be a huge relief for many patients.
Right.
It just simplifies the whole process,
Yeah.
makes it less intrusive in their daily lives.
And that could, in turn, positively impact the technicality aspect, right?
Got it.
Less frequent dosing
Yeah,
means less need for complex calculations and adjustments,
exactly.
which could make patients feel more confident and in control of their treatment.
Absolutely.
And there's even the possibility of less frequent glucose monitoring with icodec,
Oh, yeah.
which could be a game changer for some.
Huge.
It's not about eliminating monitoring altogether,
Right.
but potentially making it less burdensome for patients.
Definitely.
So less hassle,
Yeah.
less complexity, potentially less monitoring.
Yeah.
It does sound quite appealing.
It does.
But of course, we need to be realistic.
Sure.
icodec is not going to be the right fit for every patient.
Right.
The article highlights certain patient populations that might benefit the most.
Absolutely. The article suggests it could be a good option for both type 1 and type 2 diabetics requiring basal insulin.
Okay.
It's not limited to a specific regimen. Either patients on basal only, basal plus, or even basal bolus regimens could potentially benefit.
That's a surprisingly broad range.
Yeah.
And it seems like patients who are struggling with adherence to daily injections due to any of the 3 Ts
Yeah,
might see a real improvement with icodec.
absolutely. And think about the potential for creative applications like weekend therapy or directly observed therapy.
Oh, wow.
For those patients where adherence is a major concern,
Right.
icodec could be a game changer in those specific settings.
So it offers a lot of flexibility in how we can incorporate it into practice.
For sure.
Now let's switch gears and talk about the practicalities of prescribing icodec.
Okay.
The article goes into detail about dosing, titration, and injection technique. Things we need to be aware of before we start putting patients on this new insulin.
Yeah, let's start with dosing.
Okay.
The recommended initial dose for icodec is 70 units weekly,
Okay.
which is roughly equivalent to 10 units per day of a daily basal insulin.
That makes it easy to calculate when transitioning patients from a daily insulin.
Exactly. And when it comes to titration, you adjust the dose in 20-unit increments weekly,
Okay.
based on those fasting glucose levels. If a patient is switching from another basal insulin, you'd calculate the weekly icodec dose from the total daily dose of the previous insulin
Right.
and give an additional 50% as a loading dose for that first injection.
Why the loading dose?
It's to avoid any transient rise in fasting glucose levels during those initial weeks of transition.
Okay.
as the body adjusts from a daily to a weekly insulin.
Makes sense. So what about the actual injection technique?
Yeah.
Anything we need to watch out for?
Yeah.
Or is it pretty much the same as with other basal insulins?
It's a subcutaneous injection.
Okay.
Just like most insulins.
Right.
Using a pre-filled pen injector.
Okay.
The main point to emphasize is avoiding those intramuscular injections.
That's standard advice for any insulin injection.
Exactly. And one of the cool things about icodec is the flexibility with injection timing.
Okay.
Patients have a window of plus or minus 3 days from their designated injection day.
That takes the pressure off having to be super strict with the schedule.
Exactly.
Especially for patients with unpredictable routines.
Absolutely.
Now let's talk about glucose monitoring.
Okay.
This is where things get interesting.
Yeah.
The article suggests that less frequent monitoring might be possible with icodec.
Mm-hmm.
Maybe even just weekly in some cases.
Yeah, it's possible.
That's a huge benefit for patients who hate constant finger pricking.
Right.
But I imagine we still need to individualize the monitoring plan, right?
Absolutely. Individualization is key in diabetes management.
Of course.
Factors like other medications.
Yeah.
Especially those that can impact blood sugar levels, like bolus insulin or sulfonylureas.
Right.
Will play a role in determining the right monitoring frequency,
Right.
you know?
Okay, so less frequent monitoring is definitely a plus.
Oh, yeah.
But of course, patient safety comes first.
Right.
The article also dives into some potential concerns with icodec, like local site reactions, hypoglycemia, and sick day management.
Sure.
Those are things we need to address
to
ensure we're counseling our patients effectively.
Absolutely.
Let's start with local site reactions.
Okay.
Does icodec carry a higher risk of these compared to other insulins?
Well, the article acknowledges that local site reactions like bruising, bleeding pain, or lipohypertrophy are possible with icodec,
Right.
just as they are with other insulins.
Sure.
But it also mentions a couple of factors that might actually reduce the risk with icodec.
Oh, that's interesting.
Yeah.
What are those factors?
First, icodec has a neutral pH,
Okay.
which could make injections less painful for those patients who are sensitive to the acidity of some insulin formulations.
That makes sense. I've had patients who specifically request certain brands because they find them less irritating at the injection site.
Exactly. And secondly,
Yeah.
because you're injecting only once a week,
Right.
there are fewer injections overall,
Makes sense.
which naturally reduces the chances of having those reactions.
Fewer injections, fewer opportunities for irritation.
Exactly.
Makes perfect sense.
Yeah.
Now, let's move on to hypoglycemia.
Okay.
This is always a major concern with any insulin therapy.
For sure.
What does the article say about the risk with icodec?
Well, the data presented in the article is quite reassuring.
Okay.
Studies have shown lower rates of clinically significant hypoglycemia with icodec compared to daily insulins.
That's good news. But do we know how that might be?
One possible explanation lies in the way icodec binds to albumin in the body.
Okay.
This binding acts like a buffer,
Yeah.
preventing those sudden releases of insulin that can lead to rapid drops in blood sugar.
I see.
It creates a more sustained and predictable release.
So a smoother, more gradual release profile.
Right.
That could definitely contribute to a lower hypoglycemia risk.
Exactly. And even when higher doses of icodec were tested,
Okay.
studies found that the body's natural counter-regulatory responses,
Right.
those mechanisms that kick in to raise blood sugar when it gets too low, were still functioning well.
That's reassuring. We don't want to suppress those vital mechanisms.
Right.
But let's be realistic. Hypoglycemia can still happen.
Sure.
What if a patient on icodec does experience a hypoglycemic episode?
Okay.
Is it more likely to be caused by the icodec itself
Mm-hmm.
or by other medications that might be taking?
Yeah, the article points out that if hypoglycemia does occur with icodec,
Okay.
it's more likely due to other medications the patient is taking,
Okay.
particularly those known to impact blood sugar,
Yeah.
like bolus insulin or sulfonylureas,
Right.
rather than the icodec itself.
So it reinforces the importance of considering the entire medication list
Absolutely.
and making adjustments accordingly.
Yeah.
Now let's talk about sick day management.
Okay.
We all know illness can throw blood sugar control out of whack.
Yeah.
So how does icodec fit into the picture when a patient gets sick?
Right. The article advises following those standard sick day management protocols we're all familiar with.
Okay.
More frequent blood glucose monitoring, adjusting short-acting insulins or oral medications as needed,
Right.
and of course staying hydrated.
So the general principles remain the same,
Yes.
even with a once-weekly insulin.
And importantly, the article specifically states that adding a daily basal or pre-mixed insulin is usually unnecessary
Okay.
for patients on icodecs who get sick.
Interesting.
This is because icodec provides that steady basal insulin coverage throughout the week,
Yeah.
even when the patient's under the weather.
That simplifies things considerably.
Definitely.
Both for us and for the patient.
For sure.
Yeah.
Switching gears a bit.
Okay.
You mentioned earlier that icodec might not be suitable for every patient.
Right.
The article touches on this as well, right?
Yes, it does.
Okay.
It cautions that, like any medication, icodec has its limitations.
Sure.
What are some of the situations where icodec might not be the best choice?
Well, individuals who need very tight glycemic control.
Okay.
For example, those with particularly challenging to manage type 1 diabetes, or those with unstable comorbid illnesses might require a more intensive insulin regimen than what icodec can provide.
That makes sense. We always need to carefully assess each patient's individual needs and tailor their treatment accordingly.
Absolutely.
icodec is a tool,
Yeah.
not a solution for every scenario.
Precisely. And remember, it's a relatively new medication.
Yeah.
So long-term data is still limited.
Of course.
As with any new therapy.
Right.
Ongoing research and post-marketing surveillance will be crucial to fully understand its long-term safety and efficacy.
Absolutely. Continued research will provide valuable insights.
For sure.
Now, I found it fascinating that the article also touched on the environmental impact of icodec.
Oh, yeah.
It's not something we often think about when prescribing medications.
Oh, wow. Right.
But it's becoming increasingly important.
Definitely.
And icodec has the potential to make a real difference in this area.
It does.
How so?
Because it only requires weekly injections.
Right.
And potentially less frequent glucose monitoring. It can significantly reduce the amount of plastic waste generated from all those disposable pens, needles, and test strips.
That's a significant advantage.
It is.
Especially as we strive to make healthcare more sustainable.
Absolutely.
It aligns with the concept of green diabetology that the authors mentioned.
Exactly. And it's something we can highlight when discussing icodec with our patients.
Yeah.
Especially those who are environmentally conscious.
Right.
It might be a factor that resonates with them.
So just to recap what we've covered so far,
Yeah.
icodec seems to offer several potential advantages over traditional daily basal insulins.
It does.
Improved patient adherence, simplified regimens.
Yeah.
Potentially lower hypoglycemia risk,
Mm-hmm.
and even a positive environmental impact.
Absolutely.
But like with any new treatment,
Right.
we need to approach it thoughtfully.
For sure.
We still need more data, careful patient selection,
Yeah.
and ongoing monitoring to ensure safe and effective use.
I couldn't agree more, and I think the next logical step in our conversation
Yeah.
is to shift our focus to what all of this means for us as endocrinologists.
Okay.
How can we best integrate icodec into our practice?
Right.
How do we communicate its potential benefits and risks to our patients in a way that empowers them to make informed decisions?
Right. That's a great segue into the practical aspects of incorporating icodec into our practice.
Yeah.
The article talks about the importance of patient education and counseling.
Right.
It even uses the term value-added therapy to describe the impact of effective counseling when prescribing icodec.
Yeah.
What are your thoughts on this?
Well, it highlights a crucial point.
Okay.
It's not just about writing a prescription for icodec.
Right.
We need to equip our patients with the knowledge and understanding to make informed decisions about this new treatment option.
I completely agree. It's about empowering our patients to actively participate in their diabetes management.
Absolutely.
So how do we go about having these conversations? Where do we even begin?
I think it goes back to those 3 T's. Temperament, troublesomeness, and technicality.
Right.
We need to assess our patients' individual needs and tailor our approach accordingly.
So for a patient who's really struggling with the daily burden of injections, we might emphasize how icodec could free them from that daily routine.
Exactly. For someone who's anxious about needles and the technical aspects of insulin, we can focus on how icodec simplifies things. We can highlight the once-weekly dosing, the straightforward titration, and the flexibility with injection timing.
And for those who are hesitant about starting insulin altogether,
Right.
we might need to spend more time addressing their concerns, debunking myths, and focusing on the long-term benefits of good glycemic control.
It's all about personalized medicine.
Right.
Meeting the patient where they are and addressing their individual needs and concerns.
And of course, we can't forget to discuss the potential risks and side effects.
Absolutely.
Even though icodec seems to have a favorable safety profile, we need to be upfront and honest with our patients.
Open communication is key.
Right.
We should explain the possibility of local site reactions. Even if they might be less common with icodec. We need to talk about hypoglycemia. emphasizing that while the risk is low, it's still important to recognize the signs and symptoms and have a plan in place.
Right.
And we should go over 6-day management guidelines specific to icodec.
It's a lot of information to cover.
Yes.
But ultimately, it's about empowering our patients to make informed decisions about their health.
I think that's the key takeaway here.
Yeah.
Shared decision-making is crucial.
Right.
icodec is a tool.
Yeah.
And like any tool, it needs to be used appropriately.
Absolutely.
We need to collaborate with our patients,
Right.
considering their individual needs, preferences, and lifestyles
Right.
to determine if icodec is the right fit for them.
I couldn't have said it better myself. It's a partnership, not a dictation.
Exactly.
We're in this together with our patients.
And remember, we can also highlight the potential environmental benefits of icodec.
Oh, yeah. Good point. This might resonate with some patients, especially those who are environmentally conscious.
It's definitely a unique selling point and adds another dimension to the conversation.
For sure.
It's about taking a holistic view of diabetes care.
Now, as with any new treatment,
Yeah.
ongoing research and real-world experience will be crucial to refine our understanding of icodec's long-term effects and optimal use.
Absolutely. We need to stay informed, continue learning, and be open to adapting our approaches as new evidence emerges.
And that's what makes this such a dynamic and exciting field.
Yeah.
We're constantly evolving, seeking better ways to help our patients navigate this complex condition.
It's been a fascinating discussion.
It has.
And I think it's safe to say that icodec has the potential to significantly impact diabetes care.
I agree.
It offers a novel approach to basal insulin therapy that could lead to improved adherence, simplified regimens,
Yeah,
and potentially better outcomes for our patients.
for sure.
But as with any new tool, we need to use it wisely.
Ensuring that our patients are well-informed and actively involved in their treatment decisions.
I completely agree. It's an exciting time to be an endocrinologist,
It is.
and I'm eager to see how icodec shapes the future of diabetes management.
Well, thank you for joining us for this deep dive into insulin icodec.
My pleasure.
We hope you found it insightful and helpful.
I hope so too.
Remember to stay curious, keep learning, and keep striving to provide the best possible care for your patients.
And more.
Till next time, keep up the great work.